संपतराव जी.
Sir, good morning for the chief guest of today's function, Dr. Ramji Singh sir, and the former president of the Central Council of Homeopathy, and also Dr. Basme sir, the vice president of the Central Council of Homeopathy, sir. So within a while we are going to start, sir. Please bear with us. I am aware that you joined the meeting while traveling. This shows your commitment for the cause of homeopathy, sir. I welcome you, sir. The chief guest of today's function, Dr. Ramji Singh, and another guest, Dr. Basme sir. We welcome you, sir. So within a short while, we are going to start the program, sir. So please bear with us, sir.
फिगर तो दिखा रहा है कि माइक कान में लगा के कुछ किसी
नहीं इसके बोलने ने म्यूट की करे ना लास्ट
म्यूट है.
ये तो सुनाई नहीं दे.
भस्म जी तो आ गए पिक्चर में.
इसमें भी लाल दिख रहा है. काउंसलिंग वेट करने के लिए तो बोले.
हाँ वही बोले इसलिए बंद कर दिया. बोले भी कि 4:10 में उनको हमसे बात हुई ना. काफी लोग जुड़ गए. हमारे काफी लोग हमारे कोटे से भी जुड़ गए ना. रजत को नहीं फोन करके आप शिकायत भाई.
Good evening to everybody. Namaskar, Vanakkam, Namaste, Namaskara. So it is my privilege as the president of the Homeopathic Association of the Telangana. Welcome chief guest, dignitaries, and the speaker, and also all the participants. Dr. Venugopal Gauri, the General Secretary of our Association.
आपका वॉइस इधर क्यों आ रहा है? आपका आवाज इधर आ रहा है.
Sir Ramji Singh, sir, please mute yourself, sir. Mute yourself for a while. Dr. Gopala Krishna Garu, the treasurer of the association, Dr. Shivashankar Garu, the advisor, honorary advisor of the association, Dr. Ramji Singh, sir, the chief guest of today's function, this webinar, and Dr. Arun Basme, sir, another guest, and the vice president of the former vice president of the Central Council of Homeopathy. So on behalf of the Homeopathic Association of Telangana, I heartily welcome you, sir, so for this webinar. And I also welcome all the participants who joined in this webinar. This webinar is something different from all the webinars which you attended. So what way it is different, let me give a brief understanding. So there are some WHO guidelines as far as the transmission stages are concerned. So the stage 1 is the COVID will be positive. The COVID-19 test would be possible positive in those who have the travel history of other countries. This is stage 1. And whereas in the stage 2, the people who come in contact with that particular person who had the travel history, that is stage 2. So wherein in the stage 2, we are going to find the, from whom this disease has transmitted, whether from the person who traveled from outside India, from him it is transmitted, or through his contacts it is transmitted, we will be knowing. But in the third stage, which is called as the community spread, so we will be finding some of the patients who got infected, but when we try to know the contact history, we will not be in a position to find that in the community spread, which is more concern, and India is in that stage. And whereas in the stage 4, so this is called as the epidemic. More number, massive number of people, they get affected in some of the clusters in a particular country. This is called as the 4th stage, that is the epidemic. So about the transmission, we are not going to, transmission stages we are not going to talk about. So we are going to talk about the clinical management stages, which is going to be presented by today's speaker. So before that, I request our treasurer, Dr. Gopala Krishna sir, to introduce Dr. Ramji Singh sir, the president of our today's function, and also Mr. Venugopal Gauri, who is the speaker of our function, followed by Dr. Ramji Singh is going to inaugurate. I request Dr. Gopala Krishna to introduce Dr. Ramji Singh sir, the chief guest of today's function, to the August gathering. Dr. Gopala Krishna sir.
Good evening, everybody. I welcome you all to this session, and I heartily welcome Dr. Ramji Singh, the former CCH president who served very long as chairman and who has served the longest innings as member CCH, and he is principal GD Memorial Homeopathic Medical College and national president Hamai, and he doesn't require any introduction. He is a man known to everybody, most popular person in homeopathic fraternity. I welcome you, sir. And we request you to inaugurate the session.
Sir, Dr. Ramji Singh, sir. Sir is the longest served CCH member. He worked in various capacity for about 25 years as the member, as the vice president, as the president of the Central Council of Homeopathy, and he's the trustee of the GD Memorial Homeopathic Medical College, Patna, and also the present president of the Homeopathic Association of India. Sirji, Dr. Ramji Singh, sir, please, we request you to say a few words and inaugurate this session, sir.
Thank you, Sampath ji. होम्योपैथिक मेडिकल एसोसिएशन ऑफ तेलंगाना की तरफ से आज जो होम्योपैथिक वेबिनार का आयोजन किया गया है और आज की जो पूरे वर्ल्ड की जो बर्निंग समस्या है और केवल हमारा देश ही नहीं पूरा विश्व इस समस्या से जूझ रहा है, ऐसी परिस्थिति में हम तेलंगाना एसोसिएशन को धन्यवाद देना चाहते हैं, बधाई देना चाहते हैं कि उन्होंने एक ऐसे टॉपिक्स का चयन किया है और खासकर हम होम्योपैथिक मेडिकल एसोसिएशन ऑफ तेलंगाना के प्रेसिडेंट डॉक्टर संपत राव जी, जनरल सेक्रेटरी हमारे डॉक्टर वेणुगोपाल गौरी जी, आप लोगों को मैं विशेष रूप से धन्यवाद देता हूं कि आज का जो आपने टॉपिक्स रखा है ओवरव्यू एंड एक्सपीरियंस विद कोविड-19, अभी 25 तारीख को हमारे आयुष सेक्रेटरी के साथ हमारे जो फॉर्मर मेंबर की एक बैठक हुई थी 27 तारीख को, 27 को 12 बजे दिन में, उसमें डॉक्टर संपत राव ने बहुतरी कोविड-19 पर भी और रिकॉग्निशन परमिशन पर भी बहुत विस्तृत रूप से चर्चा की और हमारे आयुष सेक्रेटरी का भी ये सुझाव था कि अगर आपके पास कोई एक्सपीरियंसेज हैं, कोई अनुभव है कोविड-19 पर, तो आप हमें आयुष मंत्रालय को भेजें। तो आज यह पूरे विश्व का जो बर्निंग टॉपिक्स है और मुझे पूरा विश्वास है कि जो आंध्रा, तेलंगाना, कर्नाटका जो पहले सोचते हैं, दूसरे प्रदेश के लोग बाद में उस पर विचार करते हैं, तो तेलंगाना एसोसिएशन आज पहले इस पर काम कर रहा है और मुझे उम्मीद है कि आज के इस एसोसिएशन में जो भी डिस्कशन के बाद एक निर्णय होगा उसकी जानकारी हम आयुष मंत्रालय को भी देंगे। इसलिए मैं आज विधिवत रूप से इस वेबिनार का उद्घाटन करता हूं और ऑर्गेनाइजर और विशेष करके एसोसिएशन के अध्यक्ष डॉक्टर संपत जी और वेणुगोपाल जी को मैं विशेष रूप से बधाई देता हूं कि उन्होंने हमें आमंत्रित किया। थैंक यू, धन्यवाद।
सर, थैंक यू वेरी मच डॉक्टर रामजी सिंह साहब, हम आपका शुक्रगुजार हैं। I request Dr. Gopal Krishna Garu to introduce the today's speaker. Dr. Venugopal Gauri को आप इंट्रोड्यूस करिए।
Good evening, everybody. I take immense pleasure to introduce our dynamic General Secretary, Dr. Venugopal Gauri, who is going to deal with his experiences in dealing with COVID-19. So, a brave, dynamic practitioner who has been relentlessly trying to see and find the usefulness of homeopathy in this dire situation. So we have to first congratulate him for his enthusiasm and courage for treating COVID patients, and he has completed his graduation from Gulbarga Homeopathic Medical College, and he has done his post-graduation from Patna Homeopathic Medical College, and presently he is a very popular practitioner in Twin Cities. He is also an editor of our monthly journal, Medicina Futura Homeopathy. And to his credit, he has many publications and he is popular as speaker in many sessions. So now I request Dr. Venugopal Gauri to commence his deliberation.
So Dr. Venugopal Gauri is the product of the Gulbarga Homeopathic Medical College for the UG, and he completed his PG, none other than the former president of the Central Council, Dr. Ramji Singh Sir's College, GD Memorial College. I request Dr. Venugopal Gauri to start his deliberations, please.
Namaskar to my President Dr. Sampath Rao ji, the chief guest of today's evening, Dr. Ramji Singh ji, and senior people of homeopathic faculty all over the country, Dr. Arun Bhasme ji, my guru Dr. Shiv Shankar Kunapareddy ji, my senior elder brother and my guide Dr. Gopal Krishna ji, and to all the participants who have been able to come here this evening. Namaskar to all of you. Indeed, it's a great opportunity for me to be the student of my teacher, Dr. Sampath Rao ji. I passed out in '92, but even today, he is my guiding force. He is my inspiration, and I cannot but follow his advice because it is always useful, productive, and efficient whenever you do it. And it is indeed a great opportunity to be under the guidance of Dr. Ramji Singh ji, in whose college I did my post-graduation, MD. Thank you, sir. Patna is our second home, and Hyderabad is a very cosmopolitan city, and people from Patna and Bihar, or for that matter, any part of the country, when they are here, they feel very happy. And it concerns to Hyderabad and Patna, I think they are twin, sister cities, because they have the same culture, same background, and also the same strength of hospitality. And thanks for your guidance, sir, and being able to come here this evening. And thanks also for all the efforts that you have been putting in right from the time when this epidemic has come into our country. And you have toiled hard to see that the Central Council of Homeopathy and the governing council that today is governing the voice of the government. And to your credit, in April, the government has heard your advice, and they have also started to permit clinical trials in homeopathic medicine in treatment of COVID-19. And in the days to come, we were very sure that our clinics would be there for all the COVID-19 patients. And the Department of Ayush on the 29th or the 30th of May released an advisory that homeopathic medicine can be used as an adjuvant therapy in COVID-19. As things rolled out by the mid of June, when the lockdown was totally lifted in state of Telangana, and in many parts of the country, we were expecting that a number of patients of COVID-19 would be rolling in, and true to our imagination, there were a stream of patients, and it is a great opportunity for a homeopath to be there in this situation and try our efforts to see that this virus can be tamed with homeopathic medicines. It is right from the beginning, right from the time this pandemic started in February, and Department of Ayush has come out with the advisory that arsenic alum is the preventive medicine. We have been working on that, and we have been following closely the ICMR guidelines and also the WHO guidelines, and the team of doctors here in Hyderabad, and also our always under the guidance of our teachers. We would have a regular meeting, either online or in person, during the month of February and March. And we were imagining that if at all it comes, we have to be ready to face the situation. And the great opportunity that we had is the fact that this pandemic, the virus, spread to Europe first, because probably they were not very careful about the situation to start with. And there were a number of cases there, and we have a lot to learn from their experience, right from Europe and also the other big continent, the Americas, which are also equally troubled with this virus today. Having said that, by the time the virus has reached our shores, there has been a tectonic shift in the sense as far as knowledge of the homeopathic practitioner is concerned in facing this crisis, and also the fact that basing on this pathology and the richness of the miasmatic knowledge that the father of homeopathy, Dr. Samuel Hahnemann, has afforded to us, this is living its tale today, and we are able to make a few remedies which are suitable for the situation and be ready to face the crisis and the infection. I would be just sharing the screen, please. So always we've been discussing how to go about this pandemic, and my young friends, because they are fearless. The good thing about youth is they are fearless, and they have come out with this saying that nothing in life is to be feared, it is only to be understood. Now it is the time to understand more so that we may fear less. So that is the adage that we are working on. And thanks to them, the young generation who have been prodding us, the older generation that have been advising and inspiring us, we have been able to see about 362 patients of COVID-19 by the time of 18th August this year. And amongst the 362, the number of male patients are 196, and the number of female patients are 166. As it were, probably the estrogen hormone has a way to prevent this virus from manifesting easily, and that's why they say that probably less women are affected because of this virus. It has been an observation by many, and true to that fact, although there is not much of a difference between the male and female, definitely the number of female patients that we have seen is less than the males. And the number of children affected below the age of 18 years was 34. A number of pregnant women whom we could have seen in this time was 5, and the women affected during postpartum was only 1. That is probably during the parturition time when she was in the hospital, she contracted this disease, and the infant also developed this disease, but they're all both out of it. And more importantly, because we have been kind of prepared that this kind of a pandemic not only could affect us, and it would be a daily routine at our clinics in the days to come. And we have been informing our patients that we would be ready for the crisis. And we have been educating them with small snippets, videos, and some information about the disease. The good thing about it is the number of patients who presented between the first and third day of the illness was 204 out of 362, which is 204. This, in fact, is the strength of homeopathy, I feel, because they could come in early, we have been able to do more justice to them. As they come in later, it becomes that much more difficult as the pathology has already taken its course, and it becomes tougher and problematic. And as we know, this disease runs in a very active phase only for about 9 to 10 days. It can only replicate in the human body for 9 to 10 days. And the person infected is infective for only 9 to 10 days. This is the only chance that we have, that is the 9 to 10 days that we can protect the patient from the COVID-19 while it is in the body, and also to see that it doesn't leave its impact on the body and the patient doesn't lose out because of this virus. Then the number of patients who presented between the 4th and 7th day was 105, and the number of patients who presented between the 8th and 10th day was only 28. And as a matter of fact, let me also tell you that fairly, if the patient was coming in with an oxygen saturation of less than 90, we are asking them to go in for oxygen support. And though we would love and like to treat them and help them during the phase also when they have been hospitalized and when they have been on oxygen support, but for various reasons, because it is a quarantine area, there is no way even the family can get into that precincts of the hospital and they can give them the homeopathic medicine. We are unable to see that action of homeopathic medicine during the time when the patient is hospitalized. I'm sure in the clinical trials that will be done in the days to come, definitely we'll have a better role to play, and there also we'll be able to confirm the action of our virus. And the number of patients between the 11th and 14th day, because what happens is, in spite of the disease running its course in 10 days, there is an amount of pathology that has been taking its toll. And that's why between 11th and 4th day, and also it's a gray area which was the first day to say. So such cases also we've been able to treat, which is not many. And the biggest problem with COVID-19 virus is that it affects a certain area of the population. That is people who are hypertensive, people who are diabetics, people who are obese, complications, who have cardiac diseases, issues, they are more prone to this condition. So amongst the 362, we have found that 56 are hypertensive, 79 are diabetics, obese people are 27, cardiac issues people came in with 15 number, and pulmonary diseases 48. And amongst the data that we have been able to procure over this 2 months, probably 70 days to say so, of the 362, 284 are only on homeopathic medication. And we are always told them that homeopathy is an adjuvant treatment and you are free to do what you want to do. And but they opted for 284 of them opted only to continue homeopathic medicine. And of them, some people have taken allopathic medicine and also our medication. They are about 78. And amongst the 362 who have come into us, according to today's number, we had to hospitalize 12 of them. It shows 10 here, but we have to hospitalize 10 of them. And mostly those who have come in late, the pathology has become intense. So the number of patients who deceased while under our care was 3. And in the allopathic medicine, that is the 78 patients who have taken the allopathic medication, 56 of them have taken the flu medication. The remaining 22 have just taken antipyretics and blood thinners. And we are not stopping them also, because insulin dependent diabetics and also people with cardiac issues where the cardiac output is very low, they are more likely to have more complications. And if they are going in for blood thinners, we are not actually stopping them, and they deserve a better chance of getting through this crisis than before. Confirmed COVID cases that we have, of the 362, we have a RT-PCR confirmation of 75 of those patients, and HRCT of the chest have showed pneumonia changes, typical viral pneumonia, COVID 4 and 5 of 154 cases, and the rapid antigen test positive of about 10 cases. The remaining, you would see there's a gap of about 100 between what we are saying, the number of cases that we have seen, and the number of confirmation of COVID that we are seeing. That is because if a patient is losing only smell or losing only taste and there are no other symptoms, generally, according to WHO guidelines, there is no need even to test a patient for COVID-19 unless he has a nasal blocking and he is unable to breathe through the mouth. Only under such circumstances you need to do the test, number one. And number two, if a patient's family amongst 2 of say 4 or 5 are already infected with coronavirus and they have been confirmed to be COVID patients, if the other people in the family develop similar or dissimilar symptoms that can be of COVID-19, we are also not testing them. And there are many cases where the government facility of RT-PCR and antigen tests are not easily accessible for the people, and nor is it affordable for them that they go and get the test done. Under such circumstances, uh, we are unable to ask them to go for a test. Having said that, for all these patients who do not have undergone any tests for COVID-19, we have tests, serological investigations where it shows that they have an increased lactate dehydrogenase, an increased D-dimer, or an increased CRP, or a decreased lymphocyte count. That helps us to understand that definitely it is COVID-19. And amongst the 362 ones, people below 60 years are 281, above 60 years are 81. And the number of patients whom we have tested for decreased lymphocytes we have found, which is a typical feature of COVID-19, 35 patients, and the white blood cell count less than 4,000 usually means a viral illness. The number is 32. Patients who presented with increased ESR 62. Now patients who have showed the chronic inflammation or the acute inflammation being very active, the C-reactive protein being evident, they are 72. And LDH increased number is 59. Patients with more ferritin are 45. Patients with increased D-dimer or the clotting factor, or where the tendency for clot is more, is 45. And the number of patients who have increased interleukin 6 are 18. And the number of patients who are less than 93 of oxygen saturation are 42. So as of 28th of August, we have completed 357 cases who have got through this crisis, and under medication are 47. And as of for now, we have 404 number of cases, of which 47 are running the course of treatment. So according to the World Health Organization, they say if a patient has symptoms of acute upper respiratory tract infection like cough, sore throat, and runny nose, sneezing, fever, fatigue, myalgia, and other digestive symptoms, they have to be considered as mild. And if they have pneumonia with frequent cough but with no obvious hypoxemia, or if it is just about less than 93 and more than 90, it has to be considered as hypoxemia, where the patient, you can understand that is entering into the psychotic and syphilitic manifestation of the disease. And the mild symptoms, where it is mostly only the SORA, the latest SORA which has been awakened, and that has aided the COVID-19 virus to enter into the body and have its say. And amongst the critical patients, what the World Health Organization says is that there are, if the patient has oxygen levels more than 90, and if they've already developed acute respiratory distress syndrome, or where they are in shock or sepsis, or where there is a stroke that has risen out of COVID-19, or there is a coagulation dysfunction and kidney injury, it is a critical case. So amongst the 362 number that we are quoting, with the mild type of illness, the patients that we have are 108, with moderate to severe type of illness 215, and with severe to critical type of illness is 39. And thanks to the founder of our system of medicine, Dr. Samuel Hahnemann, he has clearly enumerated what an acute disease is. In the aphorism 72, he quotes the disease to which a man is liable are either rapid morbid processes of the abnormally deranged vital force, which have a tendency to finish their course more or less quickly, but always in a moderate time. These are termed as acute diseases. And COVID-19 strictly falls under these protocol, if you say. And acute diseases can be individual, it can be sporadic, or it can be epidemic. And now we are beyond epidemic, probably a pandemic. And it is obviously a transient explosion of the latent SORA that has resulted in this, and which can spontaneously return to the dormant stage if the acute diseases were not of too violent a character and were soon quelled. Either the acute disease will go away as a self-limiting disease, or it could remain in the body, causing a derangement or a loss of function of a particular area of the body. And the acute disease can be either psychical, emotional, meteoric, telluric, calamities, wars, and inundations. And we have seen, as CCRH has rightly said, the toll of the mental health in COVID-19 virus has been huge. And they have also called for a research study on this particular area of COVID-19, where the number of people that have been affected by COVID-19 and how they can be helped with homeopathy. And I'm sure we'll see some good guidelines to come in the days to come. So about the acute diseases and COVID-19, this acute miasm of COVID-19, how it fits into this disease has been well enumerated in the Organon of Medicine. And as we are aware, there are three predominant miasms that can actually run the course of the disease: the SORA, the psychosis, and the syphilis. And there are three distinct phases of these diseases also, as our Department of Ayush has also classified and helped us in terming these. And they are depending on the symptoms, degrees of the symptoms of the disease we have been able to observe in the people, that we have been able to notify whether it is under which miasm or which miasm is active during that phase of the disease. And it is also today the world of medicine understands that the disease can vary according to the type of the interaction of our human body with a particular virus. So even along with that, the disease can be classified. And as the specialization of our system of medicine is irrespective of the cause of disease and the seat of the disease that a particular remedy can act upon, we definitely have to consider the individualized symptoms of each patient to come to a particular remedy for the patient, and also depending on the stage of the disease. So amongst what have we been seeing in this particular COVID times that the patients have been showing or presenting in our clinics? So the first and foremost symptom that the patient complains is, now we all know that the virus enters through the nose, the eyes, or the mouth. These are the three entries that the virus can enter into the body. And that is the reason why the ACE2 receptors that the virus finds helpful to enter into the body are mostly found in the nose. And predominantly, the most number of cases are because the nose is the receptor for the viral infection, and that is how it enters into the body. And more importantly, so in the days to come, this ascends and it has its say in the posterior nasal area, the roof of the pharynx. And that's the reason why most of the patients complain that they have, there is a feeling that as if something is stuck in the top of the throat and they are unable to clear it. And it is only a matter of time that it can enter into the lungs to cause a deeper infection. And it is also another reason why it can go from the throat into the ear, because the eustachian tube gets blocked. And a good number of patients also complain of earache, and also complain that their ears are blocked and they are unable to hear as well as they used to in the previous couple of days. And amongst the presentations that we have, apart from the throat irritation, the pain in the throat, and the dry cough, which is usual in this case, but dry cough usually starts in the third or the fourth day. That is mostly when the pulmonary complications are about to set in or on the way. That is when this disease becomes more active. And so the other presenting symptom that we have been seeing at our clinics is a typical headache, that is a pain behind the eyes, the frontal headache, so typical of dengue fever, that it is there and it presents itself. So we have to say that probably it is COVID-19. And fever with just 99 degree. Most of the patients do not come with a high fever episode. It is mostly with a 99-degree fever, and usually it is complained with a chill and never a rigor. So it is only a chill, fever and chill. You have to suspect, especially in the season, that it could be COVID-19. And the other important presenting symptom has been diarrhea. That is, you have to imagine that the viral load is too much, that it has entered from the nasal cavity or the mouth directly into the gastrointestinal tract, and it has affected the small intestine to cause diarrhea right away. So that means the patient has a bigger viral load. Having said that, let us also understand that the World Health Organization says if a patient comes with a presentation of diarrhea as the first symptom, not necessarily the later symptom. If diarrhea is the first presentation, they are very, very less likely to have complications typical of COVID-19. And and undue tiredness. Even with a 99-degree fever or a little chill, the patient feels so weak and tired that something has hit upon him. And very unlike or unusual presentations are a skin rash, which we could see 2 of the patients had skin rash, and aphthous ulcers are also another way they present themselves, which we have seen a few, either as a presenting symptom or during the course of this 9 days that we have seen the aphthous develop. If the patient is presenting to you at the clinic with breathlessness, it obviously means that this patient already has, a manifestation that has come down from the nose, which is just the psoric manifestation. And now that it has reached the lungs, though, so probably it is already in the psychotic stage. Now, having said that, so the more important or the significant symptom that we have been able to see at our clinics is the lack of smell and also lack of taste. Lack of smell is usually the first symptom to arise, and lack of taste comes second. And usually, if there are no other symptoms, we usually do not ask the patient to go for any checkup or RT-PCR confirmation of the disease. But if they have symptoms apart, I mean, like they could be having a sore throat or a fever or a chill, and later also develop lack of smell and taste, that does not mean that they cannot have complications. A presentation only with lack of smell or lack of taste means that the patient is very less likely to develop complications. So apart from this, the skin rash, what we just discussed, and the other rare things are, the back pain or other usual manifestation could be pain below the knee joints, again, typical of COVID-19. Now, having said that, everybody has a right to say these are usual symptoms that can happen if you are if you have not slept well, or if you have had a cold thing and you have developed a sore throat. So, World Health Organization says if you have 3 symptoms of the above things, then it is very likely that it is COVID-19. Also, if a patient has a family member who has other symptoms of COVID-19, you have to imagine that this patient and his family have probably have developed COVID-19. So now we've been able to see about 34 children. Less than 18. 18 is not a child though, probably a young adult, but still in the teenage. What World Health Organization has said is, till the age of 10, these patients have a thymus gland which is still functioning. And for adult physiology, when they encounter a COVID-19 virus, it is usually a novel coronavirus. But when it comes to a young child with a thymus gland intact and functioning and ready to prod and make B and T lymphocytes, then definitely that means every virus that is entering into their body is a novel virus. And that is the reason why they do not get as affected as an adult. And that's the reason why they do not have as many complications as adults have. And more often than not, in children, what we have observed is they come in with an abdominal pain or a diarrhea or a sore throat. These are the main things, and of course, sometimes associated with fever. In COVID-19, the 362 presentations, we can say number of patients who did not have fever as a presentation. It is not necessary that they have a presentation of fever right from day one to have COVID-19. It could be later also. So more importantly, what we are talking today is how the pathogenesis of the disease is taking place in the body, how we are able to match up this with the miasmatic evaluation, and how we can arrive at probable remedy for this particular condition. As we are aware, the first symptom that this virus can cause is in the nose, if at all, because that is the first receptor area for this virus, and these ACE2 receptors promptly pick up the virus and can allow it to enter into the body. So now the cilia try their best in the nasal lining, along the bronchi, bronchioles, and also till the stage of the alveoli. The human body, human system, immune system tries its best to see that the function of the body is retained and it is not affected by this virus. And with the sensation of, with the symptom of cough, it tries to expel this virus from the respiratory tract. And it is still in a soric stage that when the latent sora is affected, this particular symptom is there. So it is trying its best to see that the virus is driven away from the body, but it is overwhelming. This COVID-19 virus is overwhelming, and it doesn't leave time for the human system to respond and react. And that's the reason why they do not respond to it easily, and the virus has its say, it goes down into the alveoli. And what we know as a typical pneumonia, what we have been seeing all these years, is that it can get into the alveoli, it can cause an exudate, it can cause it could be a pus, or it could be a discharge, mucus discharge, and that body tries to expel it as much as possible. But when the tissue does not respond and the tissue is unable to do so, and the virus, the bacteria, the fungi can have their role, and that causes a dense opacity that we can see in an X-ray or a CT scan to be called as a pneumonia. But as we have seen in pneumonia, it is usually one-sided. That is, any bacteria or a virus, usually it causes a one-sided, or only one lung is affected. But in COVID-19 virus, the important thing is usually, to start with, the lower lobes are affected, and gradually it rises to the middle and the upper lobes of the right lung, and also the upper lobe of the left lung. And typically, the manifestation of this virus, as the radiologists have helped us to understand, is in the basal portion of the lungs and the posterior portion of the lungs. And let me also remind you, friends, that it was Homeopathic Medical Association of Telangana. Right from March, we have been able to, this disease and try to act upon this as much as possible. And that's the reason why during the Dr. Ramaiah Memorial Oration in March, we had called upon a radiologist, Dr. Shilpa, Dr. Gayatri, a pathologist, to understand what has been the pathology of the disease that has been acting up in European continent at that point of time. And I will like to imagine today that if we are better placed in tackling this virus, it is because we have gained the knowledge of the disease from them right from the time this virus has been manifesting its wares in around the globe. Then once this virus has entered into the lower lobes, now typically the CT scan shows that there is a ground glass opacity of the particular area where that has got affected. These ground glass opacities are so typical that there are very few other viral pneumonia that can cause this. And in the pandemic time, that is the reason why when a radiologist gives us a helping hand in understanding the manifestation, they clearly tell us that in this stage of pandemic, you have to consider this as a viral pneumonia, probably due to COVID-19. And now what happens in this pneumonia at this point of time when compared to the other pneumonias? So once this virus has its manifestation in the alveoli, the air sacs that exchange the carbon dioxide and the oxygen at this level, they are unable to do so because the mucus gets entangled and is not necessarily expelled easily by the lungs, and it becomes a problem for the body to get rid of the virus. This is when you can imagine that the soric manifestation is beyond, and probably the psychotic manifestation is saying it's taking its toll on the body. And the COVID-19 virus takes the help of all these metabolic diseases that we see today, like the diabetes or the cardiac manifestations and the hypertension, which are nothing but in a way a psychotic manifestation. That that's the reason why these individuals are more prone to this condition. And no wonder obese people who have psychotic manifestation as their predominant area of concern, they are more prone to this condition. You would be surprised to know that a person who is 35 and weighs 105 or 110 kg is equally vulnerable as a 75-year-old who is an insulin dependent diabetic. So you can understand the impact of obesity that it can that COVID-19 can have on the human body. So this is the area, now the Kurukshetra is the lung tissue, the alveoli, and this is where the war is between the virus, the human body, and the homeopathic medicine trying to help the vital force get over this crooked China virus. So now that there is no enough exchange of gases in the lungs, the disease now enters into the vascular stage of the disease. In the sense, the alveoli or the air sacs are clearly supplied with a rich amount of blood with healthy capillaries that bring on the fair blood to be exchanged with carbon dioxide and take in the oxygen. But because the virus has taken its toll and there is an obstruction to it, there is no way that the lung can do its job, and the pneumonia has now entered into a phase where the blood vessels or the circulatory system of the body has been affected, and this is where a thin line of a difference between the psychotic stage and the syphilitic stage that is going to start right from the time of now, and the cytokine storm that it can have deleterious effect on the human organism. So when you come to this stage, now the exchange is poor, the amount of oxygen that has been being carried by the blood vessels is poor, and the body reacts in a very difficult way, and it does not understand what to do. And that's the reason why when the capillaries become thin and brittle, and there is every chance for them to break and bleed. And this is the time when the vascular supply also is compromised. As the arterial hypertension increases, there is a narrowing of the main arteries of the body, especially the pulmonary artery, and the area where it has got affected, that is alveoli, there is a formation of thin fluid, and but the blood is not sufficient for exchange. The oxygen is not there for the body to exchange, and this is enough time for the microthrombi to form in the capillaries around the alveoli, and these microthrombi from the ground glass opacities can go into the circulation, and that can cause a compromise of vascular supply to the main organs of the body, whether it is the heart, the kidneys, or the brain. That's the reason why you have patients presenting with you with confusion. That means the neurological aspect of the body is also affected, And that's the reason why you can have patients developing strokes. And that's the reason why myocardial infarction is a common occurrence. And it can also be in the kidneys. And that's the reason why the kidney functions can keep going down and low. So this is a very, very important stage of the disease. And this is when this is the time, or this is the time we can act fast and act quick, as fast as a virus. So this is when is a challenge for homeopathic medicine. Once the alveoli are full, they become less elastic and they become ground for microthrombi, and these microthrombi can form into a bigger clot, and they can enter into the blood circulation. So the other feature of this particular virus is that these thrombi can be in both the veins and also the arteries. That's the reason why you can have manifestation with venous embolism as well as arterial blockages. And in fact, one patient who has been a known patient of varicose veins last year had consulted us, but then after using homeopathic medicine only for 4 weeks of time, he stopped using because he did not feel the pain and the cramps that were usual at that point of time. And later on, he stopped medication only to send a scan of a Doppler of the venous system of the lower limb to show a huge clot in the saphenous vein, saying that I've been asked to undergo surgery. But then at our clinic, we insisted that he should undergo a COVID-19 test, because the need of the hour is probably that this patient is also having an embolism because of COVID-19. And it came out that the RT-PCR showed COVID-19 positive. And later he was promptly admitted, and anti-clotting medication was given. So now we know the biggest killer of the COVID-19 virus is not just the pneumonia, but what hangs behind the curtain, that is a thromboembolism. So right from day one, this manifestation of the psychotic pneumonia and thromboembolism can happen between 4 and 7 days. And if this is not treated promptly, can go into a cytokine storm from the 8th day to come. There are some patients who have manifestation of cytokine storm earlier, but having said that, it is mostly after the 8th day. And it is an observation at our clinic, and also many other physicians have said so, that the pneumonia that was occurring on the day 2 or probably on the day 3, predominantly in the European and the American continents, is not happening as early in India. And it is only after the 4th or the 5th day or the 6th day that we are seeing in our country. So that is in fact a welcome sign for us, because we have a little more time to act on the patient and for our medicine to be more prompt in its and prevent side effects. This is a welcome change. And this also means that the patient is having mutation, or the virus is mutating as it is going from one continent to the other, and also from the cities to the towns, and also later into the smaller rural areas of our country. So this is a welcome change, because that itself means probably the virus may not be as long lived as we are fearing that it could be. So before the thromboembolism, let me tell you that the number of patients who had CORADs 4 to 5 at our clinics was 92, and CORADs 1 to 3 was 52, and CORAD 6, which means that CORADs 5 plus RT-PCR positive shows a lesser number of positive cases. So we have just spoken about the thromboembolism and how it can cause a stroke by going into various organs of the body. And this is also a time to test for D-dimer, or a clotting factor. And the most dangerous part of the disease, we have been able to confidently tackle the first two stages of the disease, both mild to moderate and moderate to severe. But definitely from severe to critical, we are definitely unable to manage. That is because the patient definitely needs oxygen support, and that can be done only in a hospice care, and they need to be observed for the serological investigations almost every 12 hours. And we should understand what a cytokine storm is. Now that the alveoli have reached the stage where there is a brittleness and there is a oozing of fluid around into the area. Now, cytokines are actually a helpful messaging system of the body. Now we have a Central Bureau of Investigation which has many wings around the country, and if they find an offender who is likely to go to the other part of the country, they are going to pass on a message to the other parts of their intelligence bureau to make them understand that this particular offender can come with this kind of a gun or this kind of a propaganda and all that, to identify the person more easily. So our body has a tremendous immune system where it can differentiate between its own and what is foreign. So it has a system where it can help itself and also damage an offender that can enter into the body. But when it comes to this COVID-19, this messaging system, that is a cytokine system, which spreads the message of immune system from one cell to the other part of the cells in the body, goes to a stage where wherein the system autoimmune disease is kind of evoked, and the virus has its way, and receptors also along the lining of the endothelium and also along the lining of the capillaries, that these cytokines can attack. They can make the wall of the capillaries more brittle, and that is how the red blood cells and white blood cells that are freely running in the capillaries around the alveoli get a entry into the white blood cells or into the lung tissue of the body. That is when the cytokine storm starts. When the cytokine storm starts, it is unable to differentiate between what is its own and what is not a part of the body. And these cytokines go and attack their own important organs of the body. So this is the syphilitic stage, and we need to understand that these are the three very dangerous things, that is the thromboembolism and the cytokine storms being the most dangerous. And that's the reason why, if we can control the patient right from the manifestation and also during the psychotic manifestation, and do not allow the patient to get into a syphilitic manifestation, we have won the game. And if we can keep observing the patient that they do not lose oxygen on walking, after walking, if they have a drop of oxygen saturation of more than 4 points, then definitely oxygen. And it also means indirectly that they have some microthrombi entering into their circulation, and they need to be investigated very promptly and very immediately. Now, having said that, what are the investigations that we do? If the patient presents to us between the 0 and or 1 to the third day of the disease, where it is only the soric manifestation, where it is mostly the runny nose or the blocked nose or just the loss of smell or a irritation in the top of the throat or an earache or a diarrhea, that is when we think that the patient has just started to have the disease. And now we just ask the patient to go for a complete blood picture, an erythrocyte sedimentation rate, and a C-reactive protein. Now, it is very easy to say, how come this patient now is having a COVID-19? Why not? It could be a flu. Why not this particular patient be a case of malaria or a typhoid? It's a very pertinent question. But having said that, this COVID-19 virus, despite its antics and the the way it can actually trouble the humans around the globe, it has left its traces. And a significant number of patients of COVID-19 show with a low lymphocyte count. Now we know that in a viral disease, usually a white blood cell count is less, and so too in COVID-19, it is going to be less than 4,000 per cubic millimeter of blood. And but usually the lymphocyte count, like in dengue or other viral diseases, it will be more. But in case of COVID-19, predominantly it will be less. So if it is less than 1,000, that means absolute lymphocyte count. If it is less than 1,000, it can lead to serious disease, and you can keep a watch on this patient, whether he needs to, whether he is likely to go into the syphilitic stage, and you can have a watch. If it is less than 80, it is even more dangerous, and you have to keep a watch on him. And we had 3 patients who had a lymphocyte count of absolute lymphocyte count of less than 490. So, and right from beginning, we were very aggressive with our style of medication because we found a clue in this particular patient. Usually when the lymphocytes are low, and the neutrophils would naturally be, as a compensatory mechanism, high. And if the neutrophils are plus the monocytes are 3 times the number of lymphocytes, that is neutrophils plus monocytes, 3 times that of lymphocytes, that is the NLR ratio, what we call, then the patient is set for a serious disease. So we have to keep a watch over him right from day one. Now, how do we differentiate this from dengue fever, which is also a viral fever, and in some patients of COVID-19 also, which we saw only the other day, where the platelet count was 58,000, but we insisted that we are going to treat you only for COVID-19. The patient was definitely upset, but we had a reason to say so, because though NS1 antigen of the dengue patient was positive, the IgM, that is a active part of the immunoglobulin of the disease of dengue, was negative, and the patient already had manifestations of a viral disease. So we insisted that it cannot be a dengue fever, and we started our own protocol for COVID-19, and today he's also better. The lymphocytes, which were 13, the minimum level what we want is 20. They were 13, and they have jumped up to 45 in a stage of 72 hours. So that is what our homeopathic medicines can do if we can treat them promptly and aggressively at the right point of time. So the other thing when we can differentiate with dengue fever is when the packed cell volume is low. Dengue fever is something which drains or strains away the vitals of a human system, and they enter into dehydration very early, and it is very, very important that they are hydrated as early and as significantly as possible, whether through oral, and if they are unable to tolerate because of nausea and vomiting, you have to insist that they go for an intravenous injection. And probably we have a feeling as homeopaths here that if we had collected data last year, we had a short of a pandemic. We cannot say pandemic because it had not crossed continents. We had an epidemic of dengue all over the country. And if we had a significant number of cases where we could show that the platelet count increased after our medication, where the packed cell volume came back to normal levels after our medication, probably the authorities concerned about homeopathic treatment in viral diseases would have had a different idea. But then that's stage something past. So this is an opportunity for us to collect as much data as possible, learning from our mistakes, and to see that they are not repeated. And next pandemic, homeopathy should be the front runner. In typhoid also, the other disease that we need to differentiate at this point of time is typhoid, where neutrophils are less and lymphocytes are more. And there are, we know that COVID-19 can appear like a bacterial infection because the neutrophils can be less. It can appear like a viral disease because the lymphocytes can be more, and it can appear like an AIDS virus because it pulls down the CD4 count, total CD4 count. and it can appear like an autoimmune disease because it can increase the C-reactive protein and the LDH like significant proportions. So this is a multifaceted virus, and we need a multifaceted protocol and a challenge to face this virus. Now let's see how we can do this. And the epidemiologists have said the other reason why it cannot be dengue fever and why it can be COVID-19 when the pandemic is active is because what our founder has said 230 years ago. When a greater dynamic affection is there, the lesser dynamic affection does not manifest. And if the COVID-19 virus is there, the dengue virus hides and waits for its time, but it does not manifest itself. So the science of medicine today understands in a better way what our founder has said 230 years ago. So, and we young friends, when they understand cricket better, we keep talking to them to make them understand why when a COVID-19 is active, why a dengue fever is unlikely to manifest itself. Because you have one batsman who is doing very well at the crease, maybe a lesser known name like Dinesh Karthik, who is making every ball go to the boundary and the wicket falls, and but Dhoni is a bigger name. Just because Dhoni is a bigger name, it doesn't mean that Dhoni will get the strike. Because Dinesh Karthik, a lesser known batsman, is in form, Dhoni will wait for his time. Dhoni is dengue and will wait for his time or probably retire. But the stage is for COVID-19 today. And if you see a number of dengue fevers increasing in the population, it is an indirectly a good sign, because it means the number of COVID-19 patients are going down, and that means the dengue fevers are increasing in number. So that's what we need to understand from the science of today, the epidemiology of today, and bow our head to Father Samuel Hahnemann for leaving us a science which can be explained by whatever quality of research that comes along in the days to come. So the investigations as we come back is the complete blood picture where we understand where it is, and erythrocyte sedimentation rate is what we do in a bacterial infection. And if it is half of, it should be less than half of one's age. Say a 60-year-old presents to you, if it is more than 30, that means the stage is an active COVID-19 virus. The patient can have a COVID positive, but as long as the inflammatory parameters are less, that means you are the master of the game and COVID-19 is lagging behind you. So if the other, usually we see erythrocyte sedimentation rate only in bacterial infection, but because this particular virus also shows up as a bacterial infection, manifests itself sometimes as a bacterial infection, the ESR also remains high in such people. So, so in women, we have special consideration. So if they are 60, for any number more than 30 plus 2, that is half their age plus 2, that means the disease is active. And now we come to the other inflammatory parameter, that is C-reactive protein. C-reactive protein is a peculiarly beautiful investigation test that can show up positive and more in number. If it is more than 6, then we consider it as positive. But for a COVID-19 patient to be aggressively positive, the number has to be more than 25. And if it is more than 75, it is that means the disease is very active. And if it is more than 100, that means this particular patient can go into complications. He is an ideal candidate for syphilitic stage to manifest, and you need to be watching your guard. And the highest CRP that we have seen was 183, and then 175 and 150. So, and all of them responding well to homeopathic medicine. Then the significance of this particular COVID-19 virus is there are two things, as my teacher has always reminded me, Dr. Sampath Rao. inflammation and rapid onset. So you have to be on your toes. You cannot be lagging behind. You have to be thinking out of your hat. You have to conjure up some magic from your hat for this particular virus to see that it doesn't gain over you. So rapidity of onset and the second thing is inflammation. Watch out for both these things, which is dangerous. And this CBP, SR, CRP will keep testing in the days to come, not just till the third day, but after the fourth day, you just need to go for lactate dehydrogenase test just to see that if the patient has active pneumonia. If the pneumonia is more, then it will show up as more than 225 units. So that's when you need to be active, and a number more than 500 means that you have to act fast. So the other manifestation and investigation that you need to do between the 4th and 7th day is the serum ferritin. This COVID-19 virus has a high time in our human body, and it has a tendency to break down the red blood cells. And that is the reason why when the allopathic world conjured up hydrochloroquine sulfate for this particular viral infection, they did so because typical to malaria, wherein the red blood cells are destroyed, so too in COVID-19, the RBC are destroyed. So the thin membrane of the RBC is more prone to this, and probably with the fever and chill that is typical of this virus, especially till the pneumonia stage, they thought HCQS is a good candidate for their thing. And if China was Syncona officinalis, I mean, China was the birth of homeopathy, and I'm sure China itself will be the rebirth of homeopathy with COVID-19 for the China virus. This we have said so during our oration in March, when the pathologist and the radiologist and our other speaker, Dr. Praveen Kumar, were there to talk about COVID-19 virus. When we come back to the investigation of ferritin, if it is because once the RBC is broken down, there is free iron in the circulation. And why would a vegetarian who would always have low ferritin or low iron levels have increased ferritin levels in the circulation? You have to suspect that it is an inflammation, and it is because of the free iron in the body. And that's the reason why once it is promptly deposited from the blood circulation into the liver also protests, saying that I'm unable to handle this much of iron in the body, and don't think this is the dumping yard of the body. And that is when it protests and shows up with an increased alkaline phosphatase level in the serum investigation. So during the 4th and 7th day of illness, apart from the CBP, ESR and CRP, we need to go for the LDH, serum ferritin, and the D-dimer when it comes to the 7th and 8th stage. That is because we need to be on our guard to understand whether this disease is about to produce any microthrombi in the circulation, or the patient has a tendency for microthrombi. So if the D-dimer is more than 500 units, it's a bad number, but it is only when it is more than 1000, then we need to understand that this particular patient needs to be had a close look at. So, and of course, what we are doing at our clinics definitely is that apart from the CBP, SR, CRP, LDH, and serum ferritin, if there is a tremendous weakness, tiredness, and if the patient feels they are unable, they may fall even while walking a few steps, and if their oxygen saturation is good, 92, 93 plus, and there's no reason for them to say so, then we are asking them to go for a serum electrolyte test to understand whether the lack of electrolytes or the draining of hydration from the body is the reason for this disease to manifest itself. And the electrolytes, if they are low, we can promptly help them with correction of electrolyte substitutes. Then apart from this particular investigation, when we let go of the patient on the 14th day saying that they are cured, we ask them to go for a interleukin 6. Interleukin 6 is another cytokine, which means if it is more, that means the cytokine storm is ensuing in the body. And only if the CRP, LDH, and D dimer are more, then we are asking for this expensive investigation. Because otherwise, when the LDH and CRP were back to normal, there's no reason for this patient to go for the test. And there were some patients, they say the 7 picograms per nanoliter is what is the upper limit of interleukin 6 is. And at our clinics, we have seen a patient who was 5,500 picograms per ml, and they came back to normal in 7 days, less than 900 though. And whenever the patient has a decreasing titer of any particular investigation in the body, you can understand that they do not need any more active medication for a particular thing, and they don't need any more investigations also. So now that we have seen through the investigation part in the 1 to 3, 4 to 7, and also 9 to 11, and usually till the 14th day, if we understand that these patients do not show any symptoms, they are on an upward trend as far as their energy levels are concerned, and if their parameters along the investigations are showing positive, you can declare them as a corona warrior, and you can add one more to your number. Our target is 500. I want our guru, Dr. Shiv Shankar sir, to bless us to do this number and present this to our fraternity. So now we know how the disease is acting in the body, and now we understand what we need to be doing to see that the disease does not have an upper hand over us as far as the treatment is concerned. So we have, there are no marks for guessing, or it's not something great that you can find something from our Materia Medica. What has been written 200 years ago finds its place in treatment of COVID-19 in 2020 today. And the number 2020 should be a good reminder for all homeopaths to understand that the prescription has to be 2020. It has to be swift and act fast and rapid. And no matter what you do, you are not wrong as long as you get runs on the board and you get patients off the danger line, and they are back into daily life as happily as possible. So it is important to understand these remedies according to the lines of this pathology or miasms, the SORA, the psychotic, and the syphilitic. And that is how we have chosen these remedies. First, initially, definitely, as far as the area of or the seat of disease is concerned, we have chosen these remedies. And no marks for guessing if it has to be arsenic alb for the first time, always, because arsenic alb is a remedy, as we all know, which will run its course, whether it is SORA, psychosis, or syphilis. It will have a beautiful role to play. And right from the time, Ayush department has also given us an advisory that it can be used as a preventive. We have been actively following that, apart from doing whatever we felt that was more appropriate for that patient. So we all know what it can cause along the nasal lining, what it can cause in the respiratory tract, and what it can cause along the gastrointestinal lining. But there are some areas where we can find that these remedies are particularly special, in the sense, thanks to the Pharmaceutical Press London, who have studied the biology of the animals that have been given the crude substance of our homeopathic medicines. They have seen physiologically the changes in the particular organs of the body, and they have been able to bring about the symptomatology and the pathogenesis. This is where we have taken these from the Pharmaceutical Press London, and we have taken from the Borix Materia Medica, of course, which is our favorite Materia Medica. And then also from TF Allen. I thank my friends Dr. Meena Deshpande for helping me in this, and Dr. Sagar for actively coordinating this. And Boiron Company has in fact given an online pharmacology of all these drugs. And you will be surprised that arsenic alb causes a decrease in the cellular energy. And that is exactly what happens in COVID-19. And for our body to fight the virus, we need something internally which can reduce the inflammation, that is a steroid. And arsenic alb evokes the steroid metabolism of the body to fight the disease. And now we know the cytokines, the interferons that can be active in the cytokine storm, and they pass on the message well. When there is a low viral count, they can inhibit the synthesis of the viral counts. And when the cytokine storm is going on, even then arsenic alb is a beautiful remedy, because then also in low concentrations, it can interfere with the interferon and the cytokine activity. And we are all aware how it can act on the digestive system. And that is why number of patients who have COVID-19 have cholera-like symptoms or profuse diarrhea. And here it reminds us also of the small intestine diarrhea that COVID-19 can cause, the podophyllum diarrhea, where it is profuse, painless, polychromatic, and all that. So, and we know its action on the respiratory system, and how it can wield its action on pneumonia. And the worst part of this COVID-19 virus is that it can benumb the brain stem into imagining that oxygen levels are good in the body, and it does not allow the body to feel bad that there is something wrong. And this does not make the body realize that there is something wrong. That is the reason why patients are in happy hypoxia, that even when the oxygen saturations are 60 and 70, where they can just go and crash while walking, they do not imagine or understand that they are having such low levels of saturation. And that is the reason why arsenic alb can be chosen, as it acts on the nervous system. And we know how it can avoid strokes also in this particular virus. And progressive inflammation is the main stay of this viral disease. And arsenic alb is top of the charts when it comes to fighting the inflammation. Then the best thing that can run along the course of arsenic alb right through the disease, according to the SORA, psychotic and the syphilitic stages, is our remedy phosphorus, and which is also complementary to arsenic alb. And as we are all aware, how it can cause hemorrhages into the circulation, how it can act on the lung parenchyma, how it can act on the heart muscles. So, and there's a beautiful line in this particular book of pharmacology given by Boyron, which is a compilation from the Pharmaceutical Press, London, edited in 2000. And my friend Dr. Sridhar Gunda was good enough to share that with me. Sorry. That the clinical evidence of the lesions is more important than the characteristic signs of individual reaction. So when the deep pathology is running, when we have to catch up with the pace of the virus and what it can do or damage in the body, we have no time to think. We have to act. We need to have a protocol of remedies on the table for the patient, even before the patient appears at our table for a prescription. And I think arsenic alb and phosphorus should be the mainstay of treatment right from day one till the end of the course of the disease, which you see through the patient from happy hypoxia to being a happy warrior of COVID-19. Then I had an opportunity also to work with a stem cell scientist, Dr. Vijayalakshmi Venkatesan, where she was working on the inflammatory parameters on the islet cells of Langerhans or the pancreas, where we could show with remedy carcinosin in the tissue cultures that the inflammation can be significantly reduced. And Fobister, who proved this remedy, says that if there is one indication for carcinosin, it has to be inflammation. Even in patients with autism, where we imagine that inflammation is the reason for the disease to manifest itself, we actually start every patient of the disease with a dose of carcinosin or more. just because of this one lining, that is inflammation. And when COVID-19 was around the corner, we had no doubt in our mind that carcinosin should be a part of the protocol of treatment for COVID-19. And as we just discussed, China Self is here to stay. And right from the time I've seen its action with my guru, Dr. Shiv Shankar sir, in his clinics, just 3 doses of China Self 10M, malaria is gone for good. I mean, it was so good. I mean, that experience still rings in my mind 27 years down the line. And when there are fever, when there is chills, and the best part is, even in the psychotic stage, when the hemorrhages are taking place and the debility of the hemorrhage can take its toll, or when the clots are about to form and fluid loss and inflammation are the reason for that COVID-19 to be aggressive, Chininum Sulf is a beautiful remedy to have its action and stave away the virus. And thanks to Dr. Rajan Shankaran, who has brought more limelight to this particular remedy, camphor. We have seen that this is a remedy when the thin line or the page that can be crossed from the psychotic to the syphilitic stage of the disease is crossed. The camphor has its best role to play. And Dr. Hahnemann himself, who was a prover of this particular remedy, was at pains to understand, because there was a rapid change of symptoms and he was unable to record the symptoms as well as he would have loved to in particular camphor. And the short duration for which these symptoms would last, that made camphor special for him. And if you understand COVID-19 today, it is how short the small the disease can be. That is, the cytokine storm can happen in a matter of 48 to 72 hours, and the symptoms can be ever changing. That is, the first day the patient could have a sore throat, second day the patient has diarrhea, third day the patient has fever with chills, then the next day he has pneumonia-like symptoms and breathlessness. So it goes on. A same patient can have need not have the same symptom again all through the disease. So Hahnemann is proved right today that for the rapid onset of symptoms and also the ever-changing symptoms of camphor, which do not allow the symptoms to last not longer, camphor is a beautiful remedy, and it should come in right from the day one, because it is not that the patient will have the remedy while he's in cytokine storm. The challenge is to see that the patient does not go into the storm. So we need to start all these remedies early and very early in the disease. And if our confidence has been increased in COVID-19 treatment, it is because of this particular remedy. And my good friends, good young friends, Dr. Ramya, Dr. Shreya, they have been studying this disease right from day one. And we were at pains to understand during the second week of June when the pandemic started, and we revisited our Materia Medica all over again. And we came to understand that patient does not show any symptoms of the disease, but when, or very little symptoms of the disease, we say 99-degree fever, but on the 5th day or the 6th day, you go for a HRCT, there are ground glass opacities all along the 3 lobes of the right lung and the 2 lobes of the left lung. This is unimaginable because it is a silent pneumonia. It is a pneumonia which does not show much symptoms right from day one or even later in the disease, because breathlessness comes later in the disease. And iodum is a particularly rapid acting disease. And we found that in the pharmacology textbook also, that the mononuclear leukocytes whose phagocytic action is marked, iodum helps in rising to the particular infection. Probably that is the reason why we do not have any other second remedy for pneumonia. It is just iodum. And that is after arsenic, calcium, and phosphorus. We have put our faith on iodum, and it has not failed us in pneumonia. And if we can stop the first stage of disease itself, then that means the later stages of the disease are that much more easier to be curtailed, or they don't manifest at all. So it is very, very imperative that you start off well. You have very good opening batsmen, and the mainstay of good batsmen coming after one down, as they say in cricket. So iodine is our remedy for COVID-19 pneumonia. And CarboVeg is no marks for guessing, because it's a beautiful remedy. And as the patient keeps coughing, and the suffocating cough of respiratory infections is usually linked to the presence of respiratory syncytial virus. And this is what was written decades ago. And we have a similar virus that is acting today. And we have hypoxemia. That is when the patient walks, he has hypoxemia and then continuous cough, and patient on walking has fever, which is again typical of COVID-19, increase of fever, I mean. And you know its action on the respiratory system, and you are aware of its action and how it can act on the cardiac decompensation, how it can act on the stroke and prevent strokes, how it can act on the venous blood to prevent coagulation. So CarboVeg is a remedy that will that is definitely top of the charts, and which can be employed as a reserve kind of medicine. Once a patient is having that in his hands, we can always advise him over phone that he can take this particular remedy at this point of time. Then another remedy which can also act on the respiratory phase, lining, and also on the vascular system is ammonium carb. And this is also a remedy for patients who get exhausted very easily. And this COVID-19, you know, can exhaust the patient so much that it needs somebody to wake them from this slumber or this exhaustion. I think ammonium carb, or the smelling bottle that they used to call a couple of centuries ago, will wake up this patient out of this coma-like condition. Then as we understand thromboembolism today, it can occur in the venous circulation, it can happen in the arterial circulation, it can cause a stroke, it can cause an embolism, and it can cause all the dangerous effects of the disease. So if you can control pneumonia, well and good, and if it has crossed the second stage into thromboembolism, your clock is ticking and you need to act fast. And we have found that Bothrops has a plane of action both on the arterial and the venous system, and and the disseminated intravascular coagulation that is typical of COVID-19 virus is that there is a fluid blood and there is coagulation. So the patient can bleed on one side and they can have an embolism on the other side. And Bothrop raises to the challenge like no remedy. So, and it is also a remedy, as our teacher, Dr. Sampath Rao sir, kept reminding us, it is a rapid disease and you need to be rapid too. So it is a remedy that can act very, very fast indeed. And it is a remedy known for capillary hemorrhages. And one thing I forgot to tell about CarboVeg also was Dr. Gopal Krishna sir keeps advising us, when the patient has dyspnea, please don't hesitate to give in a millismol potency. You can put it in a few drops of C dilution and use it for nebulization. And we have done that n number of times, and the patients recover so well all the time. So the big brother of Bothrops has to be lachesis, and Dr. Banerjee of Calcutta, Banerjee Clinics often uses that in asthma, and has richly guided, saying that this remedy can act in asthmatic conditions, and patients who have had pulmonary diseases before and who are prone to hemorrhages now, they need to be under a watch of lachesis. Sorry, and as we also know, it has an extremely good action on the circulatory system also. And another remedy that comes into play is nitric oxide or amyl nitrosum. If you give nitric oxide, the remedy which can act on the pulmonary hypertension, because it has a contraction, the coronavirus causes a contraction of the arteries and the main vessels of the body, you need a remedy which can help in its dilatation. And so amyl nitrosum, if you can employ from as early as day 3 or 4 for a patient with COVID-19 and who is more susceptible to developing clots and strokes, amyl nitrosum is the remedy. And we have also gone through enough literature of COVID-19 where they say strokes are a very common condition, not just during this 9-10 days of the illness and the 14 days of the quarantine, but also till 45 days to 90 days of the disease. And we can freely employ this amyl nitrosum remedy and Bothrops and also Lacosis in the days to come to prevent that patient does not have a stroke and have the effect of the coronavirus even after it is dead and gone from the body. So like now we have seen many patients of chikungunya virus who would say the pains are lasting even for 4 years. That ankle pain of mine reminds me that I had chikungunya about 5 years ago. So COVID-19 also, as they say now 8 months down the line in China, that they are having symptoms that can keep recurring. That is the fever or sometimes the more pathological manifestations like the stroke or the coronary attacks. So if we can have these remedies as a follow-up of remedies in the days to come, and also a remedy like tuberculinum. And having said that, psychotic phase of this disease is such a small phase that it is a SORA, and then how it's through psychosis into syphilis is the main challenge, and that is how it manifests. And so truly so, tuberculinum has its action on the post-COVID conditions of the patients, and invariably helps them recover faster in the post-COVID phase. That is what my guru, Dr. Shiv Shankar, has advised, and which we have been giving to all post-COVID patients. So, which is also a SORA syphilitic remedy, which acts on those planes. So, I think we should have that in mind and be ready to prescribe that. And again, coming back to inflammation. Number one, inflammation on the lungs. Number two, inflammation on the circulatory system. Number three, inflammation on the immune system itself. So we have all known colchicum for only that. We chanced upon this remedy because a lot of allopathic doctors, they said, what is the best remedy for fever, especially for patients who seem to be having them when there's not much of a pathology, when the CRP seems to be coming down, the ES are coming down, but the patient doesn't let go of the fever, 99 to 100 degree fever, even till 45 days of the illness. And they said, if you give colchicine as an anti-inflammatory medicine, so definitely it helps them relatively come out of it faster. So taking a clue from them, after China Self, we have also introduced colchicum for patients who keep having this intermittent fever, and it works like, well, I don't want to use the word magic because homeopathy is not magic, it is pure science. And we have a great mechanism in the human body, the immune system, and which can rise to the challenge and the demand, and it can produce a natural steroid to bring down the inflammation, and also to see that the cytokine storm is controlled if at all necessary. The adrenal glands are always up to the task, and they don't waste time when it comes to producing cortisol. And that's the reason why when the body is under duress of this coronavirus, the other remedy that has been used by allopathic system of medicine is dexamethasone, which is nothing but cortisone. So under the guidance of my two teachers, Dr. Sampath Rao ji and Dr. Gopal Krishna ji, we could make a tautopathic medicine out of this. Actually, there is a remedy out of this, but it is not available easily in the market, and our suppliers are not able to help us in this moment of crisis. So what we did was we took dexamethasone and we got it tautopathically potentized. Then we have been using it this. We'll have more to talk about cortisone and how it has been able to help human body in this COVID-19 virus if it can be given right from day one. And the World Health Organization has said it has reduced morbidity, that dexamethasone reduced morbidity by 50% and mortality by 30% who are already on oxygen. That is a richly significant number, if you allow me to say so. And we are using this remedy to prod the human metabolism into doing what it has to do. Or if there is enough of the hormone in the endocrine hormone in the circulation and the body does not utilize them, we have been using the SAR codes of that in 6 potency or sometime in the 13 potency to prod the metabolism into making more of that particular hormone. And cortisone also, we have made both 6 and 13, and we'll wait and see how both of those act, and we'll get back to you on that very soon. And we were just discussing how the patient can go low on electrolytes. And if there are 2 remedies that can actually, you can see the sodium and the chloride levels improving in 24 to 48 hours without being given not much of electrolytes, or after being given electrolytes when the body does not absorb as much or assimilate as much as it should. Natriumur and Calimur are the remedies up to the task. And we also know, apart from arsenic, and phosphorus, especially in the first and the third stage of the illness, the SORA and the syphilitic stages of the illness, Natriumur is a beautiful remedy when it is only the pneumonia or it is only the cytokine storm that is at its peak. And Calibike is a beautiful remedy if the patient is unable to expectorate. There is a lot of mucus in the circulation and in the alveoli, and the alveoli are brittle, thinned out, and they are not having the strength. They have lost the elasticity. Calibike will clear up the case, but we cannot keep this for the cytokine storm. But if the patient has come out of the COVID-19 virus, but is still having bronchitis-like symptoms, trust me, Calibike works like nothing. And we have been also employing the mother tinctures of echinacea, and which also helps the weakness and supposed to improve immunity. And we have been using Aspidosperma, called as the digitalis of the lungs, so to improve the perfusion of the body and to see that the thrombosis does not take place and the want of circulation is remedied with this remedy. And for cough, tincture and Seneca mother tincture. And more importantly, let me share with you. I just need 2-3 minutes, doctors. Please bear with me. So the other 3 things that we are using in our day-to-day practice of COVID-19 are vitamin D, that is 60,000 units of it every day for 3 to 5 days, and vitamin C of 15 milligrams per day, 1500 3 to 5 days, and melatonin, which is a supplement that is produced by the pineal gland, but which is deficient in the elderly. And when it is deficient in the elderly, then definitely that is a reason probably people are more prone to this disease. And we have found that melanin 15 milligrams per 15 to 30 milligrams per day for 5 days prevents pneumonia, or does not allow pneumonia to manifest as much, and it also reduces inflammation. And right from day one, my teacher, Dr. Sampath Rao, as I told in many seminars before, that even in 1987, when I attended his pharmacy class, that the supplements belong to every system of medicine, allopathy, homeopathy, or any other system. And we have been employing this particular supplement because they are known to have, proven to have anti-inflammatory capacity, and they also help the rejuvenation of the patient. Vitamin B12, folic acid, and levicarnitine, which is lost during the fight with COVID-19 virus in the patients. And we have found that the market, it is called as neuro, greatly inspired by Dr. K.K. Agarwal, a past president of Indian Medical Association, who conducts mass education programs for patients, doctors, and everyone, and we have benefited from a lot from his teachings. And it is because of the confidence of hearing to those lectures that we have been able to identify patients early and treat patients early. And trust me, there was never any mortality or God's grace. We have always been able to guide patients right, and the youngsters have risen to the task, and they are just out of college 1.5 years ago. But patients today come into the clinic as their name rather than mine, which makes me even more proud. I know how proud my teacher, Dr. Sampath Rao, is feeling. That is what he has inculcated in us, and we are trying to follow in these years. And as I told you about vitamin D, in respiratory tract infections, they have a great role, and immunomodulatory mechanisms also, and in acute viral respiratory tract infections. And same as such with vitamin C as an antioxidant and a potential antioxidant for immunomodulatory properties. And melatonin, as we just discussed. Thank Dr. Praveen Saxena ji, an integrated medicine practitioner, actually, who has helped me with the dosage and also the prescription of these particular 3 supplements in patients of COVID-19. And as of now, 28th of August 2020, 357 cases have been 357 have been cured, and those who are under our treatment today are 47, and the number is 404. 404, according to software, is a file not found, but definitely homeopathic system of medicine, I strongly feel, have found the file of COVID-19 virus. And I thank my president, Dr. Sampath Rao ji, my other teacher, Dr. Gopal Krishna ji, the treasurer of our association, and the team, Homeopathic Medical Association of Telangana, and my friends, Dr. Meena Deshpande and Dr. Sagar Jambagi, in helping me making this presentation, and my team of 2 doctors, Ramya and Shreya, who are directly involved with all the patients and who have also compiled this particular presentation for me. And we are a group of few doctors who always interact with each other. And I'm thankful to my younger associates, Dr. Jayant Kumar, Gautam Ralabandi, Swapna Sandeep, Nikita Praneeth, Pratyusha, Annapurna Mantha, Samta Jain, Ananya Uppala, and Sujata for their contributions in this particular presentation, and always for homeopathy. We always discuss, and then we take it to our 2 seniors, Dr. Gopal Krishna sir and Dr. Sampath Rao sir, where it is molten into gold. The founder of our system of medicine clearly entails not just the treatment part or what are the principles of treatment, but he says in the aphorism of for our higher purposes of existence, both for ourselves and also for our patients. And I dedicate this to my homeopathic fraternity, and also my Lord Sri Krishna, for whatever little I get through this, it is at his feet. Thank you so much to my teachers and everyone. Thank you all for the patient listening. Thank you, sir.
Thank you, Dr. Venugopal, for your wonderful lecture. And always we were calling Dravids, Virat Kohli's and Dhoni's for batting, though you are a young batsman not known to the homeopathic world. So you have batted more than Karthik, and you did the justice to the topic. On behalf of the Homeopathic Association of Telangana, I congratulate you. I convey my thanks to Dr. Venugopal Gauri. And all the participants are requested to leave your mobile numbers or the email ID so that we can send you the YouTube link of this lecture. And just to conclude, so Dr. Venugopal has presented number one, the pathogenesis related to the clinical stages. He explained wonderfully. So the first stage is the mild stage. This mild, in the mild stage, only the upper respiratory symptoms are present, and the disease has not descended to the lower part of the lung or the respiratory tract. And in the second stage, which is called as the moderate stage, there will be mild or the moderate pneumonia presentation will be there, and as the pathology. And whereas in the critical cases, so there will be severe pneumonia followed by acute respiratory distress and septicemia and septicemic shock. So to begin with, the disease is starting as acute disease with the outbreak of the latent sora remaining itself to the upper respiratory tract only, wherein the azouric medicines can help us. In all the medicines what Dr. Venugopal has presented, so most of them, they are not the azouric remedies, because the stage 1 is a very simple stage. The management of the stage 2 is important in order to prevent the death rates, or in order to reduce the death rates, and in order to prevent the deaths. Because when it is entering into the second stage, so the soric manifestation is with the psychotic manifestation followed by the pneumonia. But there, so all these remedies, from arsenic alb to the cortisone, so all these medicines, they come into the picture. I must once again congratulate Dr. Venugopal Gauri for raising the curtain of understanding the materia medica in other way. So we only try to understand the materia medica with the symptomatology, but you have presented wonderfully. So the pathophysiological way of action of the medicines, and also you have taken the help of the sarcodes, and for correcting the electron imbalance, you have used the natramode and the calimode, the biochemical medicines, and you have taken the help of the mother tinctures also. So most of the medicines that you are used, according to me, so they may be in the second stage of the illness, that is the moderate stage, where the pathology is pneumonia. So of course they are also useful for the first stage also, but the real challenge lies how best we can reduce the symptomatology and restrict it to the second stage only, so without entering into the third stage. Even if they are falling in the third stage, so the same medicines they are going to help the patient. And you presented wonderfully. So in the first stage of itself, so with the help of the laboratory investigations, how to understand, interpret, so whether the disease is going to limit itself to the first stage or entering into the second, and the investigations for the first stage you identified, and the latter stages you identified, and by looking into the investigations itself, one can understand whether the patient is going from the first stage to second stage, and the second stage to third stage. Thereby, your selection of the medicines, it becomes easy by understanding the pathophysiological way of action of the medicines along with the indicated symptoms. So with this, I congratulate Dr. Venugopal Gauri once again, and all the participants are requested to leave your mobile numbers or the email so that we can send you the invitation in our future endeavors. And also, some of you have raised certain questions. So it is already 2 hours and it is getting late.
Sir, request you, sir, Dr. Shiv Shankar, sir, to give some opinion, and Dr. Gopal Krishna, sir.
Okay. So I request Dr. Shiv Shankar, sir, to give few his opinion. Dr. Shiv Shankar Garu. Dr. Shiv Shankar, sir. Are you with us, sir? Dr. Shiv Shankar Garu? Before Dr. Shiv Shankar Garu comes, I request Dr. Gopal Krishna Garu to say few words about this seminar.
Yeah, excellent deliberation we just now heard from Dr. Venugopal Gauri. So very exhaustive, lot of essential information for this epidemic, and many intricacies required to be known for this illness have been very well dealt. We just, homeopaths, we just do not make empirical prescriptions. We go by serious pathology running underway. So we all understand the subject and the method of administration of the remedies and when to, how, why. So many details are given. So I once again heartily congratulate Dr. Venugopal Gauri, but I would like him to deliberate or detail about the remedies he made a mention of: when, why, how often, in which potency, how did he. So maybe such details would help the listeners and all the practitioners for them to try these remedies. I once again congratulate Dr. Venugopal Gauri.
Dr. Venu, before Dr. Shiv Shankar Garu comes, there is a request from the participants. So for starting a website and giving a link of all the treated cases so that the participants would be, the homeopathic fraternity would be benefited. So with this, I request Dr. Shiv Shankar Garu to give your comments about this oration. Sir.
So am I visible? Am I visible?
Much visible and you are very much audible, sir.
Very good. Good evening, everybody. It was a very good talk. Not just a good talk, it was an excellent oration, giving full information, and the angle in which it was presented, as Dr. Sampath Rao said, pathophysiological angle, which is really need of the hour. And he inculcated a lot of confidence in the practitioners, especially young practitioners. Now, coming to my experience, honestly, I am not taking up many cases of COVID for obvious reasons. A few cases which I have treated, they are also from a very close friend circle or relative circle, not critical cases, just positive cases with a few doses of our medicines after a period of 10-12 days. As already Venu has explained, the mostly Rustox, Arsal, phosphorus, ending with a dose of tuberculum 1M is all my protocol of treatment. As I've already submitted, I did not treat more number of cases. As such, my experience is not very important here. But I really congratulate Dr. Venugopal Gauri for his excellent oration, which has really given a lot of inspiration to all the youngsters who have been listening to it. Thank you.
Thank you, Dr. Shiv Shankar Garu. So before asking Dr. Gopalakrishna Garu to say a vote of thanks. So I also have the experience of treating more than 75 cases. But in the phase 1, okay, when the disease is limiting to the upper respiratory tract, so the medicines like the Rustax, Bryonia, the seasonal medicines are coming into the picture. But when the infection entered into the lungs, so those medicines, if it is very mild, then only they are helping. But when it is becoming moderate, so the depth of the medicine is not sufficient, as Dr. Venu selected the medicines like the arsenicol, phosphorus, China sulf, camphor, sepia, viratum album. So such medicines were coming into the picture, but we cannot give the medicines randomly like that. Disease-wise medicines, they are not there, though some medicines come into the picture. So we should look into the symptomatology of the patient and also the depth of the pathology, and we have to select, and we should be very careful when the patient enters into the second stage, because there they are likely to enter into the third stage of severe pneumonia or acute respiratory distress, and the septicemia, septicemic shock, etc. So there, if the pneumonia is mild, then only homeopathic treatment alone, definitely it helps. But when it becoming moderate to severe pneumonia, so I feel we should take the help of the allopathic medicines also along with the homeopathic medicine. So with this, I request Dr. Gopalakrishna Garu to for the vote of thanks. Dr. Gopalakrishna.
Yeah, thank you.
1
Dr.
second,
Gopal.
can I interfere?
Yes, sir. Yes. Okay. May I know who is speaking? Hello? Somebody said, may I interfere? Okay. Dr. Gopalakrishna, please.
Yeah. While thanking Dr. Ramji Singh, our chief guest, for gracing this occasion and honoring our request to inaugurate the session, we profusely thank on our association's behalf, and we also thank all the participants and for patient hearing. And I congratulate Dr. Venugopal Gauri for delivering such an impressionable, good, great lecture. And there are quite a few eminent people who participated. Dr. Ravinder, Professor Ravinder Madishetty, Professor Charan Paul, sorry, and also our eminent popular friend, Dr. Venugopalachari. So if he is there, I would like to ask him to offer a comment. So once again, while I thank every one of you and Venugopal Gauri and his team for making such a great presentation. Thank you, one and all.
Dr. Venugopalachari, sir. I think he's not there.
Yeah. Okay, we can wind it up.
Okay, thank you, everyone. Thank you.
Thank you, one and all. Thank you, everybody. Thanks a lot. Hello. Hello. Yes, who is this? Hello. Who is this? ఎవరు కావాలి?
హలో 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 హలో
వేణు, గుడ్ ఈవినింగ్.
గుడ్ ఈవినింగ్, గుడ్ ఈవినింగ్.
వైండ్ అప్ చేసినారు ఇప్పుడే. నువ్వు
అయిపోయిందా?
అయిపోయింది. జస్ట్ నౌ నీ అది
నేనే అప్పటి నుంచి ట్రై చేస్తున్నా, ఎందుకంటే ఇది ఇప్పుడు వేణుగోపాల్ గారు కూడా బాగానే చెప్పాడు. ముఖ్యంగా ఏంటంటే ఇది మన ప్యాథోజెనిసిస్ యాక్ట్ కూడా బాగా చెప్పిండు. అయితే మనం అనుకున్నాం అంటే మనం ఒకసారి కూర్చొని, బికాస్ నౌ దిస్ ఎ ఛాలెంజింగ్ ఇష్యూ.
అవును,
ఇప్పుడు నీకు ప్రూఫ్ కాదు మీకు కాదు ఇంకా, బికాస్ డిఫెన్స్ డిపార్ట్మెంట్ 70% దే టేకన్ హోమియోపతి ఓన్లీ. భారత అవుట్ ఆఫ్ 2.5 lakhs 2 lakhs పీపుల్ ఆర్ గివెన్ హోమియోపతి మెడిసిన్ ఓన్లీ.
అవును.
అట్లనే మన మధ్యప్రదేశ్ లో మొన్న వచ్చిన మినిస్టర్లకు కానీ, ఢిల్లీలో వచ్చిన ఈవెన్ అమిత్ షా కానీ, దే ఆర్ టేకన్ హోమియోపతి ఓన్లీ కానీ, బట్ నోబడీ టెలింగ్.
అదేలే,
వాళ్ళు ఎవ్వడు చెప్తలేడు నా కొడుకు. అందుకని మనము ఇప్పుడు ఈ వీక్ లో కానీ నెక్స్ట్ వీక్ లో కానీ ఇప్పుడు నువ్వు సంపత్ నూరి పెట్టి మనము ఒక సెమినార్ టైప్ కానీ లేదా గ్రూప్ డిస్కషన్ పెట్టేసి మీడియాకు రాసేసి ఈ ఫిజియోపాథోజెనిసిస్ ఇప్పుడు మెడిసిన్స్ బాగానే చెప్పిండు అని. వాడుతున్న మెడిసిన్స్ ఇప్పుడు నువ్వు కూడా అదే చెప్పినావు కదా, మన బ్రెయిన్ వాడినాక ప్రాస్పరస్ టు హీలింగ్, మన డెక్సామెథాసోన్ లాగా ఇవన్నీ అందరూ వాడుతున్నారు.
అవును.
కాకపోతే మీడియా ద్వారా మనం చెప్తే ఇప్పుడు, ఎందుకంటే ఎసిమ్టమాటిక్ బాగైనా కనుక ఇంకా కొద్దిగా ఎఫెక్ట్ వస్తుంది.
అవును,
నేను ఐ వాంట్ టు షేర్ అది మాట్లాడి ఒకసారి అసోసియేషన్ నుంచి గ్రూప్ మీటింగ్ పెడదాం మనం దాంట్లో నెక్స్ట్ వీక్.
బాగుంటది. ఒక మీడియా ఫ్రెండ్ కూడా ఎవరైనా పార్టిసిపేట్ చేస్తే బాగుంటది.
చేయిస్తా, చెప్తా, నేను అందరు చెప్తా.
అంటే మెడికల్ మ్యాటర్స్ డీల్ చేసేటోళ్ళు అయితే వాళ్ళు సరైన ప్రశ్నలు వేయగలుగుతారు కదా. అదే
TV9 చెప్తా, NTV చెప్తా, అందరు రమ్మంటా నేను. మనమే కలిస్తే బ్రీఫ్ ఇచ్చేసి వాళ్ళకు ఏం అడిగినట్టు మనం చెప్పినట్టు అటు చేద్దాంలే కొంచెం.
అదే ఆ రకంగా అయితే ఇంకా నువ్వు ఇనిషియేటివ్ తీసుకో, నేను వీళ్ళకి చెప్తాను. నేను
తీసుకొని, ఎందుకంటే మనకు ఇంత మంచిగా ఉండగా అనవసరంగా నాకు వాడు ఏం లేదు. ఇప్పుడు వాడు ఈకో చేస్తున్నాడు, చెస్ట్ ఇన్ఫెక్షన్స్ ఉన్నా లేకున్నా మెడిసిన్స్ అవే. కానీ మింటింగ్ ఉన్నా లేకున్నదే కదా. ఇప్పుడు వాడు లేకున్నదే మందులు వాడే, ఉన్నదే మందులు వాడే, మరి ఎందుకు? అదొకటి. తర్వాత నీకు వాడు 90 దిగంగానే మొత్తం ఆక్సిజన్ పెట్టి 14 lakhs వసూలు చేస్తున్నాడు ఒక్కొక్కడు.
అవును, అవును.
ఎంత అసలు చెప్తున్నాం కదా. కొందరైతే ఈవెన్ కార్పొరేట్ హాస్పిటల్ హోమియోపతి వాడుతున్నారు, హోమియోపతి డాక్టర్లు మాట్లాడుకొని అని చెప్తలేరు. అది నిజానే. మొన్న నాకు తెలిసిన కేసు ఒకటి కిమ్స్ లో వాడిండ్రు. తర్వాత నోబెల్ అనేది హాస్పిటల్ ఉందట ఎక్కడ, పోల్నాక్ ఎక్కడ, వాడు అక్కడ వాడిండు. మనం పిలిచి నోట్లో వేసేసుకొని వాడిండు. ఓకే, కొద్దిగా డ్రాస్టిక్ కంట్రోల్ అయింది. కానీ వాడు చెప్పాడు కదా వాడు.
అవునవును, యాజ్ యూజువల్ వాళ్ళైతే చెప్పరు.
అందుకనే మనం నాకు క్రిస్టేజ్ అవసరం లేదు మనకు. కాకపోతే ఆ సిస్టమ్ ఇప్పుడు వాడుకునే విధంగా ప్రజలందరూ వాడుకోవాలి, అలైన్మెంట్ కావాలి మీరు అని చెప్పాలి.
అదే దానికి హెల్ప్ అవుద్ది. ఒకసారి మీడియా ఫ్రెండ్స్ ఎవరైనా ఉంటే నువ్వు ఇన్వాల్వ్ చేస్తే మేము వీళ్ళతో మాట్లాడదాం.
TV9 చేయిస్తా, NTV చేయిస్తా, ఆ 10 TV చేయిస్తా, మన టీని కూడా చేయిస్తా. రమ్మంటే వాళ్ళు డిఫరెంట్ క్వశ్చన్స్ వాళ్ళకందరూ డిఫరెంట్ క్వశ్చన్ ఇచ్చేసి మనం ఆ గ్రూప్ ఆఫ్ డాక్టర్స్ పెట్టేసుకొని ఆన్సర్ ఇచ్చినట్లు.
అవుట్ రైట్ గా మెడిసిన్స్ నేమ్స్ చెప్పాలి సార్. అవుట్ రైట్ గా మెడిసిన్స్ నేమ్ చెప్తే ఇట్ విల్ బి వెరీ మచ్ యూస్ఫుల్.
మెడిసిన్ నేమో పొటెన్సీ,
పొటెన్సీ.
కృష్ణ
వై యు ఆర్ యూజింగ్ దట్ పొటెన్సీ, ఆ పొటెన్సీ కూడా చెప్పాలి.
రెమెడీ, పొటెన్సీ, ఫ్రీక్వెన్సీ ఎట్లా వేయాలి, ఎప్పుడు వేయాలి, ఎంత వేయాలి, అవన్నీ కూడా చెప్పాలి.
చెప్పాలి, తప్పేమో ఇవ్వండి చెప్పినాయి అని చెప్పాలి. ఛాలెంజ్ వచ్చా చేసుకోవచ్చు, ఏమవుతుంది.
ట్రీట్మెంట్ మొడాలిటీస్ అన్ని చెప్పొచ్చు, ఏం పర్వాలేదు.
చెప్పొచ్చు, ఏమవుతుంది, దానికి ఏమున్నది.
మేము సరే తప్పకుండా విల్ ప్లాన్ దిస్ వే.
అదే ప్లాన్ చేద్దాం, ఒక 1 week 10 days ప్లాన్ చేద్దాం మరి.
రైట్ థ్యాంక్ యూ.
థ్యాంక్ యూ అన్నయ్య. రైట్ అన్నయ్య, బాగున్నారా?
విన్నావా మొత్తం అంతా?
విన్నా అన్నయ్య, 4 o'clock నుండే స్టార్ట్ అయినప్పటి నుండే విన్నా.
వెరీ గుడ్ బాగున్నారు పిల్లలు?
బాగున్నారు అన్నయ్య.
రైట్ వెరీ గుడ్.
ఓకే అన్నయ్య, రైట్. థ్యాంక్ యూ వెరీ మచ్. బాయ్.